Okay, I see people are entering the room. Welcome, everybody. The room is filling up. Appreciate you guys coming, joining me on this important topic as we approach this open season. Big decisions ahead of us. I'm going to give it a few more moments, let the room fill up some more, and then we'll get started with the material. Okay. Looks good. Looks good. Let us dive in. Welcome, everybody. Thank you for joining me. Today, we're going to be talking about should you take Medicare? Very important conversation. It's going to have an impact on thousands and thousands of dollars over the course of your retirement. Very important decision. So let us get in. But before we dive into the material, first, I want to remind everybody that these webinars, they do not happen in a vacuum. They happen because I have people supporting me. Those are my clients. Those are my members. If you know somebody who's a client or member, give them a hug and say thank you. If you yourself want to become a client or a member, I could talk about that towards the end of today's class. Okay, so let us dive into Medicare. Now, the truth is, before we dive into Medicare, what we really should point out is that you guys are federal employees, which means that you have access to FEHB. Now, the question is, as federal employees, will you retain FEHB access even in retirement? Once you separate from federal service, can you remain in FEHB? And the answer is yes. Yes, you can. That's great. But here's another thing. I'm sure you guys know that right now the government pays the vast majority of your FEHB premiums. The government pays about 70+% of your FEHB premiums. You guys pay about 30%. Will the government continue to pay their 70% even in retirement? Yes, yes. That makes FEHB super sweet. I know some people who become federal employees just for the FEHB, just for the health benefit. Fantastic. And you guys will be able to carry your FEHB into retirement. And in retirement, there's open seasons. So that means at least once a year, you will have a chance to change your FEHB coverage. Oh, and by the way, if you have a life event in retirement, that includes marriage, divorce, death, birth, those are life events. Also, if you move outside of the coverage area. Also, when you become eligible for Medicare at the age of 65. So you guys will have opportunities to adjust your FEHB in retirement, but on the top of the slide, you'll see there are open seasons. So what that means is at least once a year, you will have the ability to adjust your FEHB coverage. So what that means is if you're ever unhappy with your FEHB, you could just switch to a different FEHB plan during open season in retirement. Fantastic. So now that we have FEHB out of the way, let us talk Medicare. I will admit Medicare is a tricky topic. Now, the truth is, health insurance is a tricky topic. I don't know about you guys. I find health insurance to be very complicated. But then comes Medicare and takes the complexity to a whole new level. So we're going to try to navigate Medicare as best as we can. And I'm going to share with you not just the stuff that I've studied and analyzed along the way, but I'm also going to share with you the stuff that my clients have learned along the way. Most of my clients are retirees or pre-retirees, and they have skin in the game, let's just say. So I'm going to share with you not just my own research, but my clients in the trenches work. So should be a fun conversation. I'm sure you guys know there are different parts of Medicare. There's Medicare Part A, B, C, D, E, F, G. Now, in this class, I'm just going to focus on these 4 parts of Medicare on the slide over here. Part A, B, C, and D. Part A is the facilities. So that includes the hospital care, the skilled nursing facilities, hospice. That's included in Part A. Part B, the practitioners, doctors, outpatient care. Fantastic. Part D, medications, prescription drugs. Fantastic. And then you have this, Part C. which is also known as Medicare Advantage plans. Interestingly, Part C is actually not exactly Medicare. It's offered by private insurance companies. And in order to have Medicare Part C, you have to be enrolled in Medicare Part A and Part B. But what you do is, when you're enrolling in Part C, you're actually enrolling with a commercial insurance company. And the commercial insurance company, in order for their plan to be considered a Medicare Advantage plan, they have to provide a basic guideline of benefits that Medicare prescribes. They have to provide that certain coverage. And then once they provide that certain basic coverage, they could add additional bells and whistles. And some of them offer very nice bells and whistles. For example, some of them will provide a dental and vision benefit. As we will see, Medicare is not going to provide dental and vision. Some of them will cover you outside the United States. As we will see, Medicare is not going to cover you outside the United States. Some of them provide a quasi long-term care type benefit. It's not real long-term care insurance. It's more like an indemnity type of policy. And some of these Part C plans are super comprehensive. Some. And the ones that are super comprehensive, they are so comprehensive, they will pick up anything that Medicare Part A and Part B did not pick up. So what that means is, if you have Medicare A and B, and then you get Medicare Part C, and you get one of those comprehensive Part Cs that covers everything that A and B didn't cover, well, that sounds pretty comprehensive with the coverage, doesn't it? In fact, it begs the question, if you have Medicare A, B, and you get a comprehensive Part C, do you need any other insurance? The answer to that question is, well, no. If you do a Medicare A and B and you get a super comprehensive Part C, you're right. You don't need any other insurance. You don't even need FEHB at that point. Aha. So let me share with you some strategies that you guys can employ. Strategy number one is you could choose Medicare A, B, and then you could get Part C as your comprehensive coverage. And once you do that, you will be able to suspend your FEHB. Okay, there is the ability to suspend FEHB. By the way, not everybody has the ability to suspend FEHB. It's only the Medicare Advantage people, the TRICARE people, Medicaid people. Those are the only ones that could suspend their FEHB. But what I'm trying to say is, if you do Medicare A, B, and the comprehensive Part C, you probably don't need your FEHB. You could request to suspend your FEHB. And if you suspend your FEHB, what that basically means is you're pressing pause. You don't have FEHB coverage while it's in suspension, but in a future open season, you can re-enroll in FEHB. That's one strategy you can employ. Another strategy is you could do Medicare A and B, and instead of getting a Medicare Part C plan, you could use FEHB as your comprehensive plan. So you don't have to get Medicare Part C necessarily. You could just use FEHB as your comprehensive complementary plan. So again, strategy number one is do Medicare A, B, and C and suspend your FEHB. Strategy number two is do Medicare A and B. And instead of Part C, you just do FEHB as your comprehensive complementary plan. However, there's another strategy. The other strategy is just stick with FEHB and ignore Medicare. Now, as we will learn, there's a part of Medicare you cannot ignore. They're going to force you to take Part A. And as we will learn, Part A is free, so that doesn't sound so scary, even though there's a little bit of a problem with it. But they're going to force you to have Medicare Part A at some point. So when I say just take FEHB and ignore Medicare, there's one part of Medicare you can't ignore. That's the one they're forcing upon you, Part A. But then the question is, okay, fine, they're forcing Medicare Part A upon me, but can I ignore Medicare Part B and Part D? And the answer to that question is yes, and I'll unpack that as we go further. Before we get into the coverage of Medicare, what it does cover, what it doesn't cover, let's get into the cost of Medicare. So as I mentioned, Part C, the plans, they offer different bells and whistles. And depending upon the bells and whistles of the Part C plans, that's going to determine the price. There are some Part C plans that are super basic, that cost very little, like $10 a month. There are other Part C plans that are super comprehensive. and they cost a lot, like hundreds of dollars a month, like $700 a month, maybe even more. Okay, so the Part C plan cost is going to depend on the bells and whistles they offer. However, let's talk about Medicare Part A, B, and D, the cost of those. Part A is free, or rather, I should say, Part A, you're paying for it right now. You know, every pay period, you have your Medicare tax, 1.45% of your pay goes to the Medicare tax. Come on, there's no such thing as free. Give me a break. What this means is that there's no additional premium for your Part A. I know on the slide, it says that some people have to pay for Part A. That's nobody in this room. Nobody in this room has to pay for Part A. It's usually somebody who, let's say, is not an American citizen. Okay, somebody who's not an American citizen, they may have to pay for Part A. Okay, but you guys in this room, you don't have to pay for Medicare Part A. You get Part A for free. Part B, however, costs you money. How much does it cost? If you guys can see on my slide, in this column over here, your monthly Part B premiums depend upon your income from 2 years prior. By the way, that's the rule with Medicare. Medicare premiums are always based upon your income from 2 years prior. If you heard what I just said, you should be outraged. Why? Because I just said your Medicare premiums are based upon your income from 2 years prior. The reason why that's outrageous is because it could be that you're retired now, but 2 years prior, you were still working. Are they going to base your Medicare premiums on your income from 2 years ago when you were still working? And the answer is yes. That's exactly what they're going to do, unless you complain about it. Believe it or not, you have the ability to reach out to Medicare and tell them that you had a life event, and they will adjust your premiums. But one second, what life event did you have? You can't just lie. You can't just make up life events. What life event did you have? And the answer is, as you can see in the slide, retirement is a life event. Even though retirement is not a life event for FEHB, retirement is not a life event for FEHB, but for Medicare, retirement is a life event. So what you could do is you could reach out to Medicare and you could say, Medicare, I had a life event. I retired and my income has come down. I want you to recalculate my premiums based upon my new income. And they will do that. But if you don't reach out to them, they're not going to do that, obviously. So anyhow, these are your Part B premiums, okay? And I have the new premiums for 2026. So the 2026 premiums are going to be based upon your income in 2024. So it obviously depends on your income. Now, if you get Medicare while you're still working, you'll probably be in these brackets right over here. Right over here, these brackets. In which case, you're going to be paying this amount for Part B per month, per person. There's no family plan. There's no Self Plus One plan. This is per month, per person. So if you're married and both spouses have Medicare, multiply these numbers by 2. Oh, and that's just Part B. Don't forget Part D. If you have medications, well, guess what? Part D has a cost. What's the cost? So there are actually different plans. The average cost is going to be about $34 a month, but then there's an IRMA. What is an IRMA? It's basically a surcharge. They like slapping people. When they feel you're making too much money, they just come over to you and they slap you. So what this means is if they feel they're making too much money, they're going to add a charge to your Part D premiums. How much is the IRMA? So as you guys can see in this last column, the IRMA is that additional dollar amount. So you'll have the plan premium, $34 plus whatever the IRMA charge is. And again, this is per month per person. Now, what happens when you guys retire? So your income is probably going to drop you into these first few brackets right over here. So this will be your Medicare premiums per month, per person. And again, if you're married, multiply times 2. But your income is probably going to spike in retirement at the age of 75. Does anybody know what I'm referring to? What causes your income to spike at the age of 75? And the answer is you have required minimum distributions. Required minimum distributions from your traditional retirement accounts, traditional TSB, traditional IRA, traditional 401k. And those distributions are going to be counted as income, and it's going to increase your income, which will then in turn increase your Medicare premiums. Okay? So everyone here should be braced that their Medicare premiums are probably going to jump. Like, for example, if you have to take 4.3% of your traditional accounts, let's say you have $1 million at the age of 75. I'm not talking about today. I'm talking about at 75. If you have $1 million age 75, and 4.3%, that comes out to be $43,000. $43,000 may bump you up into the next Medicare bracket. Okay? If both spouses have to take a $43,000 distribution. Oh, and by the way, at some point the percentage increases. So it goes from 4.3 to 4.5 to 4.7 to 5% to 6% to 7%. It keeps on going up and up every year in retirement. So you should be expecting rising premiums in retirement. You know what I'd like to do now? If it's possible, if there's anybody here that has access to their pay stubs, I want you to compare what you're paying for FEHB versus what you're paying for Medicare. Okay? So if you look at your pay stub, you'll see how much you're paying every pay period for FEHB. Now, I will admit, some of you have family plans right now. So when we compare the cost of a family plan versus the cost of Medicare, it might not be a perfect parallel. But for those that have either self-only or self-plus-one, that's going to be a little bit more aligned. So I want you guys to look at what you're paying right now for your FEHB. And that's a biweekly number. You can multiply that number by 26 and divide it by 12. And that gives you your monthly FEHB number. So whoever here has your FEHB numbers, multiply by 26, divide that by 12. That's how much you're paying per month for FEHB. I want you to compare your monthly FEHB number versus your monthly Medicare numbers on my slide. How much is Medicare going to cost you? And again, even if you guys get Medicare when you retire and your income comes down, so you're going to start off in these first two brackets over here. Okay, let's add this up. If you're in this first bracket, 206 for Part B plus 34 for Part D. So what does that equal to? That equals $240 or $241 a month per person. So if you're married, multiply that by 2. And then the next bracket, you have 289 plus 34 plus 14, and multiply that by times 2 if you're married. By the way, I would love if you guys could actually type into the chat box which one is cheaper and by how much. When you have your FEHB numbers and you have your Medicare numbers, which one of those is cheaper and by how much? The reason why I want you to type into the chat box is because I want the other participants in this class to be able to see the difference between FEHB costs and Medicare costs. And I'll spill the beans. You may notice that for some people, FEHB is cheaper. For some people, Medicare is cheaper. Usually the way it works is, for those that Medicare is cheaper, it's only slightly cheaper. For those that FEHB is cheaper, FEHB is usually substantially cheaper. Okay, it really depends on a couple of things. It depends on which FEHB plan you're in. It also depends on which income bracket, which Medicare income bracket you're in. Okay, but it's important for people to see what this cost is. Okay, by the way, you know who really has to pay attention to the cost? TRICARE people. I don't know if anybody in this room has TRICARE. TRICARE is the military health insurance plan. The reason why TRICARE people have to pay attention to this is because when you turn 65, TRICARE becomes TRICARE for life, which is free, but at that point, they force you to have Medicare. And as we're seeing, for some people, Medicare is more expensive. FEHB is cheaper. So even though TRICARE for life is going to be free, but it's very hard to call it free when they're forcing you to have Medicare and when Medicare is more expensive than your alternative plan. Very hard to call it free anymore. Okay? Fantastic. Fantastic. Anyhow, I want you guys to be aware of the difference in cost. Fantastic. Now, let's go a little bit further over here. Let's talk about what Medicare covers and what Medicare does not cover. So Medicare, Part A, remember Part A, that's the free part. That covers the facilities. So that includes the inpatient hospital care, skilled nursing facility, hospice care, home health care. These are included. However, these are not included. For example, overseas care. Is there anybody planning on traveling abroad or living abroad? I have news for you. Medicare is not going to cover you abroad. Also, custodial unskilled care. There's another name for that. In the insurance world, it's known as long-term care. Will Medicare cover your long-term care? And the answer is no, it will not. At least that's what they tell you. But let me share with you something that I learned along the way. So I have a relative that is the controller of a nursing home in Maryland. He's involved in all the accounting, all the billing. And he told me the following. Medicare does pay for the nursing home stay, but there's two criteria. Number one, it has to be that the nursing home stay was needed as the result of a qualifying medical event, a QME, qualifying medical event. So for example, let's say somebody fell and they broke their hip and now they have trouble walking and dressing themselves. Well, that was a qualifying medical event. Medicare will pay for that long-term care needed. Or I'll give you another example. Let's say a person suffered a stroke and now they have limited mobility. So that's a qualifying medical event. Medicare will pay for that nursing home stay, the long-term care. So that's one criteria. It has to be that it was caused by a qualified medical event. Number two is even if you have a qualified medical event and Medicare kicks in, it's limited to 100 days. 100 days. So what that means is Medicare will cover your long-term care, but only on the short term. So if I make that into a sentence, it sounds like this. Medicare will cover your short-term, long-term care. You got to be a financial advisor to appreciate these jokes sometimes. They'll cover your short-term, long-term care. But make a long story short, other than that, Medicare is not going to cover your long-term care. Okay, back on track. I mentioned to you guys that Part A is free. Okay? Part A is free. Okay, so even though Part A is free, you still have out-of-pocket expenses. So, for example, you have a $1,700 deductible that covers a 60-day benefit period. Benefit period basically means if your person goes to the hospital and then they come out of the hospital, if 60 days go by before they go back into the hospital, that's going to be a new period. However, if less than 60 days go by, then it's within the same benefit period. Okay, so $1,700, that covers about 60 days in the hospital, which is fantastic, actually, if you think about it. That's pretty good. However, beyond day 60, the daily rate is actually not so attractive. For example, days 61 through 90, $429 a day. That's higher than what you're paying with FEHB. And then days 61 through 90, these 91 through 150, which are known as the lifetime reserve days, that's an $858 daily rate. Much, much higher than what you're paying with FEHB. Oh, and by the way, after day 150, you pay all costs. There is no max out of pocket. Have you guys ever heard that term, max out of pocket? That is probably the most important term in this entire conversation. So let's define, what is a max out of pocket? So a max out of pocket is a catastrophic limit on how much you would have to pay if you had medical expenses in a given year. Meaning, if a person had the most catastrophic, disastrous year medically, is there a cap to how much they could pay out of pocket towards those expenses? Well, guess what? With FEHB plans, there's a max out of pocket. There is a cap. With Medicare, there's no cap. No max out of pocket. That is a scary thought. That thought alone might justify having FEHB. And as we will see, there's no max out of pocket for Part A, and there's also no max out of pocket for Part B. Very, very scary thought. Speaking about Part B, let's talk about Part B for a second. Part B, that includes the doctors, outpatient care, the medically necessary services. I love that word, necessary. Who determines whether it's necessary or not? Let's see what's not covered, because apparently it's not necessary. So, for example, eyeglasses and hearing aids. So if you can't see and you can't hear, That's not so necessary, is it? Also, routine foot and dental. Anybody here planning on having dental work in retirement? Because I have news for you. Medicare is not going to cover your dental. Moving back a slide, you have a monthly premium based upon your income, and then you have your annual deductible, a tiny deductible, $288, that is relatively low deductible. After the deductible, it goes into a co-insurance. They pay 80%, you pay 20%. However, your 20%, there's no max out of pocket. Very scary thought. I'll give you an example. I was giving this class to a group based out of Albuquerque, New Mexico. There's a person in the class who related that they had some heart complications and they had to go through a couple of procedures. They got the bill in the mail. The bill was for over $500,000. Now, thankfully, they had FEHB. And FEHB, the plan that they had a max out of pocket for them of $5,000. So they hit their max out of pocket, but once they hit $5,000, done. Beautiful. But imagine if this person did not have FEHB. Imagine if this person had Medicare. So Medicare will pay 80%. Okay, that's something. But this patient would still be responsible for 20%. What's 20% of $500,000? That's $100,000. That's very, very serious. Again, no max out of pocket. Very, very scary thought. Okay, let's talk about Part D very quickly. Part D, you have a monthly premium, a yearly deductible. Fantastic. There's actually no max out of pocket. There is a max out of pocket with Part D, but that's the prescription drugs. Fantastic. Let's go a little bit further. Let's talk about how to enroll, and then should you enroll. So first, how to enroll. As you guys can see on this slide, there are 3 enrollment periods. The trickiest is the one on the left, the individual enrollment period. So let's pay close attention here because it gets a little bit tricky. And it goes as follows. Medicare kicks in at what age again? 65, as we said. As you're approaching your 60th birthday, Medicare is going to start spying in on you to see if you're collecting Social Security or not. If you are 65 and collecting Social Security, you will automatically be enrolled in Medicare. Part A and Part B. They will mail you your Medicare cards. They will start deducting your monthly Part B premiums from your monthly Social Security benefit. You are literally automatically enrolled. Oh man, once you're enrolled, can you disenroll? And the answer is, sure you could disenroll. You can opt out of Part B, but you cannot opt out of Part A. As I mentioned earlier, Part A is tied to Social Security. If somebody is age 65 and collecting Social Security, you know something else about that person's life. You know that they are in Medicare Part A. Okay? They must be because it's tied together. Now, you guys may be thinking, Stephen, didn't you say Part A is free? So if it's free, who cares that I'm automatically enrolled? Who cares that I can't disenroll? It's free. You know what? If it's free, I'll take 2 of them. What could possibly be wrong with free? Believe it or not, even though Medicare Part A is free, there's a little gotcha, a little wrinkle, which you might not be so happy with. What's the little wrinkle? What's the gotcha? Once you're enrolled in Medicare Part A, or any part of Medicare for that matter, but Medicare Part A, you will not be able to contribute new money into an HSA. That's a larger conversation. I'm hoping next webinar we get into HSA, FSA. HSA is a fantastic powerhouse tax-saving instrument. But the thing is, once you're enrolled in Medicare, any Medicare, even Part A, you're no longer able to make future contributions into your HSA. You can access your old HSA money, your old contributions. You just cannot add any new money. A little bit of a wrinkle. So it turns out, by the way, that Part A is not exactly free. It costs you your ability to contribute into your HSA. Okay. Anyhow, I mentioned that you can opt out of Part B, but you cannot opt out of Part A. In fact, if anybody here wants to learn how to opt out of Part B, let me share with you a link in the chat box to one of the articles that I wrote. I'm going to put this into the chat box for you guys to have. Here it comes in the chat box. Here it comes. 1, 2, 3, and bang! I just shared a link in the chat box. So hopefully you guys will see that link and you'll have the article about how to opt out of Medicare Part B. Okay, so coming back to the slide over here. In the individual enrollment period, if you are collecting Social Security, you will automatically be enrolled in Medicare Part A and Part B. You can opt out of Part B. You cannot opt out of Part A. But 1 second, Stephan, let's say I'm not collecting Social Security. Let's say I'm 65 and not collecting Social Security. Well, if you're 65 and not collecting Social Security, you're not automatically enrolled. Then it's up to you to enroll. And you can enroll, you could go online and apply for Medicare. And if you want to apply for Medicare, there is a 7-month individual enrollment period. The 7-month period is the 3 months before the month you turn 65, the month that you turn 65, and the 3 months after. 3 plus 1 plus 3, that is your individual 7-month enrollment period. So far, so good? That was the tricky one. Okay, so let me say this again. When you turn 65, will you automatically be enrolled in Medicare? And the answer is, it depends if you're collecting Social Security or not. If you are collecting Social Security, you'll automatically be enrolled in Part A and Part B. You can opt out of B. You cannot opt out of Part A. But if you're not collecting Social Security, then you're not automatically enrolled, and it's up to you to enroll yourself. Okay, if you missed your individual enrollment period, don't worry, because every year there's an open season. Every year. So if you missed it the first year, you get the second year. If you missed it the 11th year, you get the 12th year. Every year there's open season. Fantastic. And then there's the third enrollment. The third enrollment is the special enrollment period. And that is specifically for people that are going to be retiring at the age of 65 or later. Is there anybody in this room that's going to be retiring age 65 or later? So if so, here's how it goes. There's an 8-month window that begins the month after your active employment coverage ends. Please tell us, is FEHB considered active employment coverage? And the answer is, while you're actively employed, it's active employment coverage. But once you retire, it's no longer considered active employment coverage. It's still FEHB. It's the same FEHB. It's just not considered active employment coverage. So, for example, let's say somebody's age 65 and they retire in February. So February was their last month of active employment coverage. March will be the first of this 8-month special enrollment window. Pretty good. Okay, fantastic. We just spoke about how to enroll. Now, let's talk, should you enroll? Should you enroll in Medicare? Especially federal employees. You guys have FEHB, don't you? Well, allow me to introduce you to the big bully. I call Medicare the big bully because at some point they start swinging at you with their threats of penalties. And they say, oh, you're thinking about not taking Medicare, are you? We have penalties for people like you. And what are the penalties? Here they are. There's a 10% premium penalty for every 12 months you could have enrolled but didn't. Now, let me remind you, you guys get Part A for free. So there is no penalty for late Part A. Even if you wait until the age of 70 plus to get your Part A, there's no penalty for you guys for Part A. However, for Part B, there is a 10% premium penalty for every 12 months you could have enrolled but didn't. So let's give an example. Let's say you could have enrolled at 65, but you didn't. And then the next year, 66, that's when you enroll. So that is a 12-month period. So you're going to have to pay the premium plus 10% of the premium. If you miss 2 years, premium plus 20%. If you miss 10 years, premium plus 100%. And as you can see on the slide, the penalty never goes away. Ooh, that's pretty intimidating, isn't it? Do we have to be scared of Medicare penalties? Do we have to be scared of the big bully? Well, allow me to give you 2 defenses against the big bully. Defense number 1, late penalties do not apply if you're still employed at the age of 65. Is there anybody here that plans on still being working for the federal government? at the age of 65, 66. Because if you're still working for the federal government and you're still covered by the FEHB, and remember, while you're working, your FEHB is considered active employment coverage. So if you're covered by active employment coverage, Medicare can't threaten you with penalties. Oh, and by the way, it's not just you they can't threaten. You know who else they cannot threaten? Even your retired spouse. So I want you guys to think about this. Is there anybody here that's going to have a spouse that is 65 and retired, but they're going to be covered under your plan while you're still working? So they're retired, you're still working, and they're covered under your plan. Because if your spouse is age 65 and retired, but they're covered under your plan and you're still working, that means they are covered by your active employment coverage, which means that Medicare can't even threaten them. Medicare can't threaten them. Medicare can't threaten you. Now, when I say they can't threaten, they will threaten. My clients have showed me the letters that they get in the mail, the death threats that Medicare sends them, the threats of penalties. And they're very pushy in those letters. If you ever look at the correspondence, they make it sound like you have no choice. And if you don't take it, there's going to be penalties. And there's going to be penalties, and the penalties never go away. They make it sound like you have no choice in the matter. Let me set the record absolutely straight. You could ignore those threats. Those are empty threats. Medicare cannot accrue any penalties against somebody who's covered by active employment coverage. So that is your first line of defense. However, there's another defense. Notice the name of the penalty. These are late penalties, meaning they are penalties for late enrollment. However, if you never enroll, well then, you're never late, are you? I'm not joking. If you never enroll, you're never late. And if you're never late, you never have to pay late penalties. So the question is, will you ever enroll? If you never enroll, you're never late, you never have to pay the late penalties. Will you ever enroll, especially you federal employees? You guys have FEHB, don't you? Can I ask you some questions? Let's be honest. Are you happy with your FEHB? Yeah, for the most part, yeah. If you were ever unhappy with your FEHB, could you switch to a different FEHB plan? Yeah, during open season. Are you going to have open seasons in retirement? Yeah. Every year for the rest of your life? Yeah. So let's put that all together. You guys are happy with your FEHB. If you ever were unhappy, you can switch to a different FEHB. You'll have the ability to switch during open season. You'll have open seasons even in retirement every year for the rest of your life. If all that is true, which it is, what am I missing? You're happy. You're happy with your FEHB. But then all of a sudden, you turn 65 and you look at me and like, Stephen, what should I do? I don't know what to do. What happened? You were happy 2 seconds ago. What changed when you turned 65? I understand that Medicare now entered the picture, and now you have the additional option of Medicare. Okay, but did that change your FEHB? Did something change with your FEHB that all of a sudden you turned 65 and now you're unhappy? Did something change with your FEHB when you turned 65? And the answer is yes. There is something that changed with your FEHB when you turned 65. And let me share with you what it is. What changed is this on the bottom of this slide right over here, non-enrollment. However, in order to appreciate the bottom, we have to appreciate the top. You see, anytime you have two insurances, any two insurances, whether it's FEHB and Medicare, or FEHB and TRICARE, or FEHB and your spouse's insurance plan, any two insurances, whenever you have two insurances, there needs to be a coordination of benefits. One of the insurance companies is going to be established as the primary payer, and the other insurance companies can be established as the secondary payer. So let's apply this to FEHB and Medicare. If you have FEHB and Medicare, one of them is going to be established as the primary payer, one of them is going to be secondary. Does anybody know which one's primary, which one's secondary? And the answer, as you guys can see, it depends. While you're employed, FEHB is primary. When you retire, Medicare is primary. Now, before we go further, Does anybody know when you have a primary-secondary relationship, any primary-secondary relationship, which payer picks up the bulk of the bill? Is it the primary payer or is it the secondary payer? Which one picks up the bulk of the bill? And the answer is the primary payer picks up the bulk of the bill. The secondary payer, they pick up the crumbs. Whatever the primary didn't pick up, the secondary usually does pick up. So let's plug this in. While you're employed, FEHB is the primary payer. They pick up the bulk of the bill. When you're retired, however, Medicare is the primary payer. Medicare picks up the bulk of the bill. FEHB just picks up the crumbs. You know what that means? That means that when you retire, FEHB is not going to have to pay out as much on your claims anymore because Medicare is the primary payer picking up the bulk of the tab, and FEHB just picks up the crumbs. Now, can anybody guess when FEHB becomes the secondary and they only pick up the crumbs, they only have a fraction of the responsibility, does FEHB lower their premiums? No, they do not. No, they do not. They still charge you full premiums, even though they only have a fraction of the responsibility. Can you imagine how excited they are as they see you approaching the age of 65? And at that point, you're going to take Medicare. Medicare is going to be the primary payer. FEHB is going to be the secondary payer. FEHB will only have a fraction of the responsibility, but they're still going to charge you full premiums. They are giddy with excitement. And can you imagine how profound their disappointment is? When you reach that age of 65 and you're supposed to take Medicare, but you decide, nah, I'm just going to stick with FEHB. Yeah. What's FEHB's reaction to that? No, you were supposed to take Medicare. We were supposed to be in the secondary seat, charging you full premiums with only a fraction of the responsibility. We are profoundly disappointed. And guess what? They have a recourse. What's their recourse? On the bottom of the slide. Let's read it again. On the bottom of the slide. Retirees over the age of 65 who do not have Medicare, FEHB will pay the hospitals and the physicians based upon Medicare rates. What does that mean? FEHB pays based upon Medicare rates. I think you know exactly what this means. I'm going to make an assumption. My assumption is that you go to doctors that accept your insurance. Is that a fair assumption, that you go to doctors that accept your insurance? I ask because I have some clients that go to doctors that don't accept any insurance. Okay, but fine. But most people go to doctors that accept their insurance. Do you know what that means, that your doctor accepts their insurance? That means your doctor has entered into a contract with that insurance company. And the contract clearly says that for any services that the doctor provides, the doctor can only charge a pre-agreed upon schedule of rates. I think you know exactly what I'm talking about. Have you ever gotten the letter in the mail called the explanation of benefits? So if you open up the envelope, it tells you the tale of what happened. Once upon a time, you got a paper cut, and you went to the doctor for the paper cut. The doctor was going to charge you $1,000 for the paper cut, but the insurance said, no, the reasonable and customary amount for this is only $100. So the doctor only charges $100. What happens to the other $900 that the doctor wanted to charge you? Can the doctor send you a bill for that balance? Can the doctor balance bill you for the $900? And the answer is no, it's illegal. It's illegal. Balance billing is illegal. The only doctors that can balance bill you are the out-of-network doctors. They can bill you for the balance. But the in-network doctors, it is a breach of the contract that they signed. Their agreement with the insurance company is they can only charge that pre-agreed upon rate. Every insurance company has their schedule of rates, including Medicare. Medicare also has their schedule of rates. And can anybody guess which schedule of rates pays the doctors more favorably? Is it the FEHB commercial option or is it the Medicare public option? Which one pays the doctors more favorably? And the answer is the FEHB commercial option pays the doctors more favorably. The Medicare public option pays the doctors less favorably. You guys know this. The government always negotiates the lowest rates. So the Medicare public option pays the doctors less favorably. So much less that the doctors are looking at the situation and they're saying, wait a second, we have two patients here. We're doing the exact same work. However, for our Medicare patients, we're getting paid so much less. You know what says the doctors? I'm not interested in Medicare patients anymore. Have you guys heard about this? Have you guys heard about doctors that are opting out of Medicare? And I get it. I understand why they're doing so. Think about it. They're doing the same work and getting paid much less. I understand from a business standpoint. I understand why they're doing this. Now, with that being said, let's read this paragraph one more time. Retirees over the age of 65 who do not have Medicare. That means they only have FEHB. FEHB will pay the hospitals and physicians based upon Medicare rates. Ooh. Who does this impact? Let's start direct. Who does it directly impact? And the answer is it directly impacts the doctors. The doctors are now getting paid less. Does that in turn impact you? Meaning, can the doctor now send you a bill for the balance now that they're getting paid less? And the answer is no, they can't. That's a breach of contract. That's illegal. They cannot send you a bill for the balance, even though now they're getting paid less. Okay, well, can the doctor single you out and say, you, now that you're 65, I get paid less, I'm not seeing you anymore? Can the doctor single you out and stop seeing you? And the answer is no. In order for the doctor to stop seeing you, you know who else they have to stop seeing? They have to stop seeing everybody else that carries your insurance plan. That's going to get rid of the people not just above 65, that's going to get rid of the people even below 65. Now, I recognize there are some lines of insurance that represent a small piece of the doctor's book of business, like 1% or 2%. So the doctor may say, you know what, it's a small piece, I'm willing to drop that line of insurance. But then there are other lines that represent a larger piece of the doctor's book of business, like 10% or 15%. For example, Blue Cross Blue Shield. Which doctor in their right mind is going to stop accepting Blue Cross Blue Shield? That's not going to get rid of the people above 65. That's even going to get rid of the people below 65. From a business standpoint, why would the doctor shoot himself in the foot like that? So, let's say this again. When you turn 65, does something change with your FEHB? And the answer is yes. The doctors now get paid less. But does that in turn impact you? No. Number one, the doctor can't send you a bill for the balance. Number two, the doctor can't single you out and stop seeing you. In order to stop seeing you, they have to stop accepting an entire line of insurance. So let me return to the question again. For those that have FEHB, are you happy with your FEHB? Yeah. If you're ever unhappy with FEHB, could you switch to a different FEHB? Yeah, during open season. Are you going to have open season in retirement? Yep, every year for the rest of my life. So, do you need to have Medicare? If you have FEHB and it's comprehensive coverage, and the doctor can't send you a bill for the balance, and the doctor can't single you out and stop seeing you, if you're happy with your FEHB, and if you're ever unhappy, you always switch to a different FEHB. So, do you need Medicare with your FEHB? Now, remember, you're going to have Medicare Part A, the free part. So that's not really the question. The question is Part B, or any other part for that matter. Do I need to have Medicare if I already have FEHB? Are you guys ready to answer the question? Are you ready for the truth? Here it comes. I'm actually going to give you two answers, okay? Answer number one, do you need both? No. No, why? Why should I pay for a second insurance? I'm already paying for my FEHB, which is comprehensive coverage. And I'm happy with my FEHB. Why should I duplicate my coverage? Why should I pay for a second insurance just to duplicate my coverage? So answer number one, do I need both? No. Answer number two, listen carefully. Is there a benefit to having both? And the answer is yes, there is a benefit. What's the benefit? Remember, if you have both, that means you'll have two insurances, a primary and a secondary. And remember the benefit of having two insurances. The benefit is whatever the primary doesn't pick up, the secondary usually does pick up, and your out-of-pocket goes to zero. We have just arrived at the crux of the decision. We have to recognize this whole conversation about should I have Medicare with FEHB, it's really a larger conversation of should I have two insurances? Is it worth it to pay for a second insurance just to have no out-of-pocket? And can anybody guess what the answer to that question is? Is it worth it to pay a second insurance to have no out-of-pocket? The answer is it depends. What does it depend on? It depends on what was your out-of-pocket with just the first insurance? And what is the cost of the second insurance? If you know those two numbers, you could do a cost-benefit analysis. I'll give you two examples. I hope you guys are following this because this is gigantic. I'll give you guys two examples. My Medicare premiums, $5,000 a year. My FEHB, out-of-pocket maximum. You guys remember what that word is? Out-of-pocket maximum. My FEHB out-of-pocket maximum, $5,000 a year. Please tell me, is it worth it to pay $5,000 in Medicare premiums to avoid my $5,000 out-of-pocket FEHB exposure? And the answer is no. That's not worth it at all. Why not? Well, why isn't it a wash? Shouldn't it be a wash? It's like 6 of one, half a dozen of the other. Isn't it a wash? No, it is not a wash. Why? Because who's to say you're going to have $5,000 in medical expenses? Why should I give away $5,000 in Medicare premiums just to avoid an iffy maybe $5,000 out-of-pocket event? That's not at all. That's not worth it at all. I hope you guys are clear on that first illustration. Let's go to the second illustration. My Medicare premiums are $5,000 a year. My FEHB out-of-pocket maximum is $15,000 a year. Is it worth it to pay $5,000 Medicare premiums to avoid my $15,000 out-of-pocket exposure? And the answer is, how likely is it that you're going to have a $15,000 medical event? When was the last time you had a $15,000 medical event? Let me ask it again. When was the last time you had a medical event that cost you, out of your own pocket, $15,000? And the answer for most people is either never or like once every 30 years. Now, let's do the math. Remember, if you don't have Medicare, that means you'll be saving $5,000 a year in premiums. And what was your out-of-pocket exposure? $15,000. So can someone do the math? If I'm saving $5,000 a year in Medicare premiums, and my out-of-pocket exposure is $15,000, after how many years will I have saved up my out-of-pocket exposure? The obvious answer is 3 years. After 3 years, I save $15,000. So what this means is, in order for it to be worth it to pay the Medicare premiums, in order for it to be worth it for me to spend $5,000 on one of those Medicare premiums, it has to be that I have a medical event, a $15,000 medical event, as frequent as once every 3 years. Do you guys see how I did that math? It's in order for it to be worth it to have Medicare, I have to be having medical events, $15,000 medical events, once every 3 years. Do you have it once every 3 years? No, maybe once every 30. And for some of you, never. Oh, and by the way, if you see that your health is declining, you know what you could do during open season? You could always switch to a different FEHB plan, a plan that has even lower out-of-pocket exposures. Remember, that out-of-pocket maximum is going to help you defend yourselves against the big bully. I'll give you the example again. The gentleman in Albuquerque, $500,000 medical event. How much did he spend out of his pocket? His max out-of-pocket with his FEHB. $5,000. $5,000 for a $500,000 medical event. So if you don't have Medicare and you just have FEHB, you're limited your catastrophic exposure is limited. So basically what we just discovered is this choice, whether you should have Medicare with the FEHB, it really boils down to your willingness to cover your out-of-pocket yourself. Meaning as follows. If I have one insurance, I'll have out-of-pocket exposures. If I have two insurances, I'll have no out-of-pocket exposures, but I have to spend extra money to have no out-of-pocket exposures. Is it worth it to spend extra money to have no out-of-pocket exposures? And the answer is, it depends. What was your out-of-pocket maximum? And what is the cost of that second insurance? And once I know the cost, then I can do a cost-benefit analysis. And I gave you guys two examples. The first example, it was clear not to do it because your cost and the out-of-pocket maximum was the same. So you're not gaining anything at all. But in the second one, even the second one, it didn't seem worth it. Because if your Medicare premiums are $5,000 and your out-of-pocket exposure is $15,000, in order to justify having Medicare, you have to be having out-of-pocket expenses of $15,000 once every 3 years, which most people are not. And even if their health is declining, they could switch to a different FEHB plan during open season. So basically, the choice whether you should have two insurances boils down to your willingness to self-insure on your out-of-pocket maximum. By the way, I know that when I say the word self-insure, it makes people a little bit nervous. However, can I remind you of something obvious? Is there anybody in this room that right now has FEHB as their only health insurance? Only health insurance? Yes, you do, right? Well, if you have FEHB as your only health insurance, don't you have out-of-pockets right now? Out-of-pocket exposures? Yes, you do. And who's covering those out-of-pocket exposures, may I ask? You are, which means you're already using my strategy. I'm not even introducing a new strategy. Unbelievable. This conversation saves my clients thousands of dollars a year. Just think about it. Just the Medicare premiums alone for each spouse is going to be somewhere between $2,000, $3,000 a person. If you have a married couple, we're talking about $4,000 to $6,000 a year in Medicare premium savings. This is definitely a larger conversation, and I would encourage anybody here who has any questions about this larger conversation to request a one-on-one with me. And I just posted something on the side. If you guys can see on the side, if anybody's interested in talking with me one-on-one, you can learn about the services that I do for federal employees. I help them make these types of decisions, financial decisions. So this gets into health insurance, life insurance, survivor benefits, debt, cash flow. I mean, all the good stuff, all the good stuff. So I'd encourage you guys to request that consult in the sidebar video. If you click on that link, it'll take you to a web form. And if for some reason you're not able to click on that link, I'm going to put the link in the chat box. Here it comes in the chat box. 1, 2, 3, and bang! Fantastic. Now, I want to turn over my attention to some questions because I see I have some questions. Somebody's asking me, is this being recorded? Yes, it is recorded. There's going to be a link sent out at the end. Ted is asking a question. Doesn't that mean some doctors may choose to drop insurance patients altogether? Our dentist did that. Oh, yeah. By the way, there are doctors that are moving to the boutique model where they're just avoiding insurances altogether. Okay. By the way, if they're avoiding insurances, Medicare is not going to help you either. Okay. Next question from First Last, right? I have Blue Cross Blue Shield, just turned 57. Fantastic. Husband is turning 65 soon. Not collecting Social Security. Question, would he need to sign up for Part B at the same time? So he just needs Part A, and he'll be covered by your, he does not need, again, like we said, he'll be covered by Part A. As far as Part B, we just had that whole discussion whether he needs Part B. You're retired, so you're no longer covered by active employment coverage. So Medicare is going to send him death threats in the mail. But as I said, it's very intimidating. Medicare is a big bully, but you don't necessarily have to be scared of the big bully because you already have FEHB coverage. He has FEHB coverage. So yes, you have out-of-pocket exposures. Okay, you'll cover those out-of-pocket exposures yourself. It's very limited. Okay, fantastic. I see another question. Another question is, Stephen, what if the federal government changes the rules for FEHB? By the way, First Last, that is a very good question. What if they change the rules? I'll give you guys a precedent. Does anybody remember what President Biden did in 2022 for the Postal Service employees. You could look it up, Postal Service reform or something like that. I don't remember the terminology. But in 2022, President Biden forced postal employees to get Medicare. They said in order for you to remain in the FEHB plan, which they switched to the Postal Service plan, right? In order to remain in it, they had to have Medicare, Part A and Part B. So is it possible for the federal government to force federal employees to get Medicare? Yes. However, let me share with you what was nice about that precedent. What was nice was that even though he forced them, there was no penalty for late enrollment. So it could be that the government changes the rules and they force you to get Medicare. And if they do, my hope is that the precedent was set and they do not penalize you for late enrollment. Okay. Fantastic. I see First and Last is saying, given the uncertainty of federal employment benefits, it seems risky to assume the government's going to pay 70%. They may change their rules. They may change the rules with FEHB. They may change the rules with Medicare. By the way, First Last, is it worth it to pay those extra thousands of dollars a year just to avoid the possibility that the government may remove their subsidy or lower their subsidy? Okay. Roth conversions. We talk about Roth conversions, of course. Yep. Retired, 65. Do I need to apply for Medicare A? So First Last, remember, only if you're collecting Social Security. I retired on 12/31/2025, or I will retire. How long do I have to decide on Medicare? I have news for you. You will have open season in January till March for Medicare, so you could just get in that open season. Fantastic. First Last, will doctor be more inclined to accept the patient if he has FEHB and Parts A and B? It really depends on that doctor's participation in Medicare. He might not be interested in Medicare. Diane, what about refund policy provided by FEHB if you take Medicare? So Diane, there are some plans that will offset some of your Medicare costs. Yeah, that's nice. So just factor it into your overall cost. You have to see, is it worth it to pay extra money for Medicare? How much extra is it if the FEHB is paying some of that portion? It still may be thousands of dollars a year, but you have to look at the numbers. Okay, I very much appreciate you guys hanging out with me. And once again, if anybody's interested in talking to me online, just request that consult. I'm pasting it again in the chat box. I'd love to see you guys offline. I wish you blessing and success, and join me in future webinars. Next month's webinar, we're probably talking about FSA and HSA. Very, very powerful topic. I hope you guys enjoyed today's class. I hope it saves you thousands of dollars, probably hundreds of thousands of dollars over your retirement. I look forward to working with you. All the best.